You have excessive weight loss, unintentional. Despite how much you eat, you keep losing weight. You are anxious for no reason. You have tachycardia with increased heart rate. You have insomnia, unable to sleep. All of those are signs and symptoms of hyperthyroidism or overactive thyroid gland. We spoke in a previous video about the thyroid gland that it controls a lot of metabolic process in the body. So it produces T3 and T4, and the brain produces TSH that controls the production of T3 and T4. With hyperactive thyroid or hyperthyroidism, you have increased production of T3 and T4 and low TSH. The cause, it could be an autoimmune disease causing Graves' disease, or it could be a nodule that produces the T3 and T4 in the thyroid gland, or it could be thyroiditis, which is inflammation of the entire thyroid gland. Now, the symptoms that we spoke, it can cause severe weight loss that is unintentional despite what you eat. It can cause panic attacks. It can cause anxiety. It can cause tachycardia with increased heart rate, insomnia, preventing you from falling asleep. It can cause visual changes with double vision, blurred vision, and the eyes can protrude too. It also can cause muscle weakness too. It can cause thin skin and loss of hair. All of those are signs and symptoms of hyperthyroidism, and if left untreated, it can cause even confusion and mental status change. Now, the diagnosis is based on a blood test. We start with TSH, testing the TSH. If it's abnormal, we test T3 and T4. And after that, if it is abnormal and we find that they're elevated, the patient goes to an endocrinologist for further testing. They can do a nuclear test for the thyroid gland. They can do an ultrasound. They confirm the diagnosis, and based on the diagnosis, we do the treatment, or they do the treatment. The treatment can involve removing the thyroid, what we call thyroidectomy. It can also include iodine treatment, radioactive iodine treatment, and also can include medication to suppress the symptoms like beta blockers. And if the thyroid is completely removed, the patient might develop hypothyroidism, which is underactive thyroid, and they will be given thyroxine. The most important thing, if you have any of these symptoms, you should see a doctor, because it needs to be treated to avoid the complications from overactive thyroid. Thank you.